Hey there, Ryan DeWitt from DeWitt Physical Therapy, talking about how to use the RODO 2-in-1 mobility tool to address any knee issues. So this is kind of a general guideline, but for the most part, if we have any pain in the front of our knee, like around that kneecap, sometimes we can get some funk kind of on our patellar tendon here. Sometimes we can have some tightness or just tissue that's maybe not gliding so well in our distal quad. So we can use this 2-in-1 mobility tool to kind of get at that whole knee. So what we'd start with is, why don't we go ahead and take it apart. And what we're going to do is we're going to do this little pin and spin on this patellar tendon. So it's really important that tissue glides. And one of the things that's nice about the texture here is that it can get a little purchase on the tissue. So if I just go ahead and kind of pull it into that patellar tendon, I can twist it. What you'll see is it kind of like takes the tissue and turns it, if that makes sense. And you can also kind of go up and down, and you can see as I'm pulling up, I'm not rubbing it on my skin, but I'm tacking it on the skin and pulling up. And that skin's coming with me as I pull up and down. I can even go side to side. I can do that pin and spin all along the joint line here and all along the joint line here. There's all kinds of things, like there's a fat pad on either side. All these tissues want to move, and if they're not moving, it can change the mechanics about what happened at the knee. So I kind of work across the front of that knee for maybe a minute or so. Next thing that we want to do also is, in our lower leg, we have our tibia, then we have our fibula, which is this outside bone that you can't really see. But it's a big site for muscle attachment. And there's a joint right here that this needs to move in order for the ankle to move. So for the ankle to move, that definitely affects the knee. So we can also use the ball to address that. This one you're going to put behind the knee and kind of slightly towards the outside. And then as you bring it in and you kind of catch it against your hamstring, it's going to push back into the calf and into this fibular head a little bit. And it's a little uncomfortable, I'm not going to lie, but you can get a really nice mobilization. So as that tissue, all the slack gets taken up, it just pushes forward on that fibular head and you can get the thing to move. And it doesn't have to feel terrible. You're in control. And you can even work on turning that foot in a little bit, turn that foot out a little bit, and just see if you can mobilize through there for, same thing, 30 seconds or a minute. Then, to get at this distal quad, why don't we go ahead and we'll put the RODO together into this peanut configuration. I'm going to put it down on the ground, and I'm going to lie down so that it's right above my kneecap. And I'm going to take this opposite leg and I'm going to pull it forward, just because that kind of like locks out my low back and pelvis. And then from here, I can literally just put some pressure on it and bend and straighten my leg, which will give me that like tack and stretch kind of approach to that distal quad. If I want, I can even keep that knee bent and do a little bit of rolling up and down on it too. It's a little bit more uncomfortable, but you're in control. And just see if you can work through those tissues for maybe, again, 30 seconds or a minute. So try those. A lot of different ways to use this thing, but try that for anything that's going on at the knee and just see if you can loosen up some of those tissues, see how you feel.